Good afternoon. I'm Dr. Deeksha, an intern in Coltene corporate internship. The topic that I'm dealing today is Brilliant Crios. Brilliant Crios is a reinforced composite block designed for fabricating aesthetic permanent restorations using a CAD/CAM grinding process. In this WhatsApp webinar, we will begin by introducing CAD/CAM restorations, stating what are the different commercially available products, in what clinical conditions are they indicated, what are the steps in preparation for receiving these products, what are the characteristics of these products, and finally we will wind up by giving tips to clinicians about the do's and don'ts with these materials. CAD/CAM is an acronym that stands for Computer-Aided Design, Computer-Aided Manufacturing, which helps the dental team fabricate precise shapes and sizes for dental restorations, including inlays, onlays, crowns, and bridges. This CAD/CAM technology provides patients with durable, aesthetic, well-fitted single and multiple tooth restorations in a more efficient manner. Firstly, a tooth is prepared as usual. Secondly, a digital impression is made so as to be received by the CAD/CAM technology. Thirdly, a suitable shade of the composite block is chosen and it is carved so as to facilitate the shape in which the restoration has to be received. And finally, once the CAD/CAM has milled the restoration that is needed, it is cemented in place with the help of a suitable luting agent. Is the same composite material also called as hybrid ceramic, or is it something very different? First of all, composite is a material with two or more bonded components in it, and a CAD/CAM composite comprises a matrix of polymerized methacrylate, and incorporated into it is any glass or ceramic fillers. Although these are also composite in terms of material designs, some companies market their products as hybrid ceramics due to the use of ceramic fillers in it. There are various commercially available materials. One of the first products in this category was marketed by the 3M company under the name Paradigm, and this was followed by Lava Ultimate, Cerasmart by GC, and Shofu Block HC by Shofu. Coltene, the Swiss dental specialist, introduced Brilliant Crios, a novel and versatile CAD/CAM composite material with high performance. To mention few other products is a composite ceramic which has a nanoceramic technology incorporated into it is Lava Ultimate, which is marketed by 3M. A CAD/CAM block which is a hybrid ceramic marketed by GC under the product name Cerasmart, and a highly aesthetic ceramic based material which is marketed as Shofu Block HC by the company Shofu. Vita Enamic. This is a product which differs from both ceramic materials and composites. It has polymer infiltrated porous ceramic and is used for minimally invasive reconstructions and posterior crowns. Brilliant Crios has chameleon-like properties which makes it blend in very well. It has a broad spectrum of 13 shades in two translucencies, that is high translucent shades and as well as the low translucent shades, which covers most of the clinicians' needs to have an attractive and natural looking aesthetics with a glossy result. Brilliant Crios has been a gold standard material in direct filling therapy, and now it also has indirect CAD/CAM restoration technology, which can be indicated in terms of giving an inlay, onlay, a crown, and also a veneer. For an inlay preparation, firstly we prepare the cavity with minimal wall thickness of 1.5 mm at least. Secondly, we sandblast and bond the inlay that is milled. Thirdly, we etch the tooth, rinse and dry it. Fourthly, we bond the tooth and cure it. And finally, we lute the inlay with luting agent and then cure it and remove the excess. Similarly, for an onlay preparation, we have minimal wall thickness of 1.5 mm left and a taper of 4 to 6 degree which is prepared. Secondly, the onlay that is prepared is sandblasted and it is bonded for 20 seconds. Thirdly, we etch the tooth surface and rinse it for 20 seconds and dry it. Fourthly, we bond the tooth surface with a bonding agent for 20 seconds and blow dry it for 5 seconds. Then we use a suitable luting agent and lute the onlay preparation on the tooth surface. We cure the luting cement and then remove excess. Here is a case study where figure 1 shows the initial situation. Secondly, it shows the cavity that is prepared to receive the inlay, and then we construct an inlay using CAD/CAM technology. A BRILLIANT Crios composite block was chosen and the inlay was grounded, and then it was used for drying. Then the tooth surface is etched using an etchant, and then it is rinsed and dried. An adhesive called 1-coat-7 universal was used and it was applied for 20 seconds, and it was cured for 10 seconds using light curing. It was sandblasted using 50 micrometer alumina, and then 1-coat-7 universal, that is the bonding agent, was applied on the inlay surface. A highly aesthetic submicron composite called Brilliant Everglow was applied to the cavity, and then the inlay was inserted and the excess material was removed. It was cured for 30 seconds from each side, and then polishing was done using the polishing tools to achieve the final look. For a veneer preparation, minimal cervical thickness is 0.3 mm and labial thickness is 0.6 mm. Secondly, it is sandblasted and bonded. Thirdly, the tooth is etched, rinsed and dried. Fourthly, it is bonded and then it is cured using the curing light. And fifthly, a suitable luting agent is used to insert the veneer in the suitable place, and it is light cured. There was a defective all-ceramic adhesive bridge, so the missing lateral incisor was replaced by BRILLIANT Crios extension bridges. The composite pontics were conditioned with 50 micrometer aluminium oxide, and the remaining enamel surfaces were etched with phosphoric acid, and it was bonded to receive brilliant Composite veneers. This is another case where missing lateral incisors were replaced with an over-contoured partial denture. So minimal buccal preparations were performed for occlusal reasons, and all the front teeth were veneered with brilliant Composite, and the dental arch was rounded. Treatment was performed without anesthesia and led to complete fixed and aesthetic rehabilitation. To receive a crown, we prepare the tooth with minimal occlusive thickness of 1.5 mm and buccal thickness of 0.8 mm with an angle of 4 to 6 degree. Secondly, we sandblast and clean and dry it, and then bond the preparation for 20 seconds and blow it for 5 seconds. Thirdly, we etch the tooth surface for 15 seconds and then rinse it for 20 seconds and also dry it. Fourthly, we bond the tooth surface for 20 seconds, blow it for 5 seconds and cure it with a curing light. Fifthly, we lute the crown with a luting agent and place it over the tooth and remove the excess and cure it with a curing light. Firstly, we see an IOPA of 37 with the existing root filling. BRILLIANT Crios color shade A2 of high translucency is chosen for milling. A milled crown of BRILLIANT Crios is seen with a residual lug which is placed on the plaster model. 1-coat-7 universal is placed on the bonding surface, and the finished crown is placed on the plaster model. Final look is of the follow-up after 4 weeks, that is after placement and polishing. For any other preparation, for an implant abutment preparation, the minimal occlusive thickness or the thickness under supporting cusp remains 1.5 mm. The buccal and the cervical thickness remains 0.8 mm with the preparation angle of 4 to 6 degrees. Secondly, it is sandblasted, cleaned and dried, and then it is bonded for 20 seconds and blowed for 5 seconds. Finally, it is luted with the luting agent and it is placed, and the excess is removed, and the preparation is cured with a curing light. This case study is of an implant placed lingually due to the normal resorption of the buccal plate. The design of the crown is pseudo-pontic to increase the oblique load on the crown. A hybrid implant crown was made with BRILLIANT Crios, cemented adhesively on top, ready to be screwed in the mouth. The image here is of the implant crown after 1 week of placement, and also the IOPA is of the implant crown after placement. Sandblasting is usually done with corundum, and it is done for the purpose of surface enlargement and retention. The sandblasting media often used here were cojet and Renfort. Renfort is aluminum oxide of 50 micrometer, or cojet was of 30 micrometer, which is marketed by 3M company. The first row shows the materials, that is the media, before sandblasting was done, and the second row shows the pictures of sandblasted media with BRILLIANT Crios. Here is another case study of an implant where the base was first prepared with an opaque BRILLIANT Crios block to cover all the metal and to condition the gingiva. Then a second optical impression was taken using a rubber dam to create a superimposed crown from an enamel colored CAD/CAM block, which was then inserted and placed. As both parts consist of pure composite, a complete bond was created between them. The tooth-like modulus of elasticity helped to absorb the forces over the implant. When these CAD/CAM restorations was sandblasted with Renfort and cojet, cojet showed slightly higher shear bond strength of 30 megapascals when compared to Renfort, which showed about 26 to 27 megapascals of shear bond strength. An indirect restoration is only as good as its bonding, they say. 1-coat-7 universal has acidic monomers in combination with mono and difunctional monomers, and it improves bonding to glass, silicate, oxide ceramic fillers and resin matrices, and hence plays a vital step in bonding the restoration to the tooth surface, and it has to be done very well. A luting cement is what we might take very lightly, but it is very important to know which cement must be chosen for the particular preparation that we have made, whether it might be light curing or a dual curing luting composite. If the maximal wall thickness is less than or equal to 3 mm, it is apt to use a light curing luting material, and if our maximum wall thickness is less than or equal to 5 mm, it is suitable to use a dual curing luting material. Polishing is that one stage which gives the final luster and shine to the restoration that we have fabricated. The chair side polishing comprises 4 steps, that is adjustment and finishing, a pre-polishing phase, high luster polishing phase, and the final refinement phase using the polishing aids that are available to us. At the laboratory, adjustment and finishing as well as pre-polishing and high luster polishing is done as done at the chair side point, but an additional polishing aid that is done in the chair side is the final refinement, which is done only once it is placed inside the patient's mouth. An increased occlusal thickness of the tooth structure that is left during tooth preparation leads to increased mechanical resistance, which is measured in force per Newton. The composite materials like BRILLIANT Crios and Lava Ultimate show higher mechanical resistance when compared to their hybrid ceramic or silicate ceramic counterparts. Wear of the material is measured in micrometer after 1,200,000 chewing cycles. BRILLIANT Crios and IPS Empress CAD have lower wear of the material that we have placed. Antagonist is the material that is present opposite to the material that we have placed. Antagonist wear is very low among BRILLIANT Crios and Cerasmart materials. Anisotropy is responsible for the exceptional resistance of healthy tooth enamel. Enamel prisms are the reason for the modulus of elasticity of enamel. The filler materials do this part in case of composites. Here it is generated by the polymerized methacrylate matrix. BRILLIANT Crios, Cerasmart and Shofo block HC have low modulus of elasticity, which is similar to that of dentin. Compared with ceramics and polymer infiltrated ceramics, composites have a lower modulus of elasticity and therefore they dampen chewing forces far better. Patients often perceive a composite restoration as being less hard than a ceramic one, so it is less likely to be experienced as a foreign body and promotes chewing comfort. Both Lava Ultimate and Brilliant Crios demonstrate higher flexural strength. Compared to temporary CAD-CAM resin materials, CAD-CAM composites used for permanent restorations have a higher filler ratio, and this ratio is mainly responsible for the improved abrasion resistance over that with low or non-filled CAD-CAM materials. Here in the graph, Vita Enamic shows higher filler ratio when compared to other materials like Lava Ultimate or Brilliant Crios, and hence has an increased abrasion resistance. A lower filler ratio implies a high polymer ratio, which in turn is largely responsible for water absorption. The water absorption of Brilliant Crios and Cerasmart is comparable to that of a modern light curing filler material at 15 to 20 microgram per millimeter cube. The polymer ratio of the composite is responsible for water absorption. Thus, Vita Enamic with its higher ceramic ratio demonstrates less water absorption than any other materials. It is known that ceramic materials can lead to increased abrasion of the antagonist during chewing as compared with dental enamel, whereas the CAD-CAM composite materials demonstrated less abrasion of the enamel antagonist compared to the tested ceramic materials and the polymer infiltrated Vita Enamic hybrid ceramic. Brilliant Crios is gentle on antagonists as is usual for composite materials, and yet it results in low abrasion similar to ceramics. Things to be borne in a clinician's mind is to always use a dental dam, keep a wall thickness of 1.5 mm or more, and a preparation with 4 to 6 degree taper, and follow the guideline. 1-coat-7 universal adhesive is applied on Brilliant Crios and any other bonding agent on the tooth, and also if any other material is used, then the respective bonding agent is necessary. Also light cure if it is a light curing material, and resin based luting cements for luting of the restoration. Few things to be avoided is to never use silane, never use inorganic cements, never lute with light curing opaque shades. If using Brilliant Crios as the material of choice, then do not fire it, and never use hydrofluoric acid for the purpose of etching. Mentioned earlier, this material is indicated in inlays, onlays, veneer preparation, and as well as abutment for an implant. But in all these cases, it is contraindicated only if the patient has reported hypersensitivity to any of these materials that are incorporated into the resin. There is often a warning sign which is present in the guideline, which has to be read thoroughly. These two images are the clinical photographs of a resin composite CAD-CAM crown for the restoration of a premolar tooth. On the third image, the black arrow shows the chipping that occurred 1 year post cementation on the distobuccal surface, which was fabricated by Cerasmart GC, and the white arrow shows the abrasive trace affecting the mesobuccal surface of the metal crown seated on the first mandibular molar, signifying a concentration of occlusal force in this region. To conclude, corundum blasting is ideal for restorations luting surfaces. An adhesive bond is to be created between CAD-CAM composite material and the luting material. Exclusively use resin based luting materials. An adhesive bond is to be applied to the tooth structure. Light curing bonding when used, always cure it after the application. After final placement of CAD-CAM composite restoration, always cure it according to the manufacturer's instructions. A mind-blowing restoration is gotten not only by excellent physico-mechanical properties of the material and correct application, but also on the accurate clinical performance of each procedural step, such as selecting a proper case, preparing the abutment tooth based on the guidelines, using the right bonding agent, and finally adjusting the restoration based on the occlusion of the patient. They all play a vital role in determining the success of a restoration. I would like to thank all of you for being a part of this
WhatsApp webinar. If there is any questions or queries or any suggestions, please feel free to post it on our WhatsApp group, and I will be available here to help and also to learn along with you all. Thank you.